Medicine going on right now, and that's vaccines.
And hello, everyone. I'm Kira Phillips. We're coming on the air with breaking news. A CDC advisory panel just voted to restrict COVID-19 shots for all Americans.
I never saw the vaccine as your 100% bulletproof from getting an infection from any one puff.
He has fired the entire ACIP advisory board, which
we always knew, and this was articulated over and over again, how the majority of hospitalizations and
people lost their jobs, people lost friends. There's a lot of people who it was kind of like a group of the vaccinated versus the unvaccinated. In fact, we had political leaders saying as much.
The NeuroTrition Podcast is sponsored by North Florida Spine and Wellness and produced by Jumin Delmas Studios.
All right, welcome back to another episode of the NeuroTrition Podcast, where we take on big conversations in medicine, curiosity, science, and just a little bit of common sense. I'm your host, Dr. Z, and today we're diving into one of the most controversial shakeups in medicine going on right now, and that's vaccines. As you've probably heard, RFK Jr. has been making some sweeping changes, especially with COVID vaccine policy. He has fired the entire ACIP advisory board, which is the board that advises the CDC on vaccination guidelines. And people are calling it, essentially, people are reacting to this as an apocalypse of public health. And we want to talk a little bit more. What does these vaccine changes really mean for you and me and our health moving forward in America? Don't forget to like and subscribe and follow us on Instagram, Facebook, TikTok, and YouTube at NeuroTrition Podcast. And please leave us a comment if you want us to cover any specific topic. To help me unpack this today, we are joined by Dr. James Cima, and we're going to look at some of the recent clips and ongoings of changes in vaccine policy. Dr. Cima, thanks for joining me.
Thank you for having me again.
Absolutely. It's a pleasure to be here. One of the first thing that has happened here recently has really been changes with COVID vaccine policy. That's the first thing. Everybody, when RFK Jr. got confirmed as the head of HHS, everyone was, a lot of the quote unquote experts were really concerned that the first thing he was going to do is change a lot of vaccine policy, and we've starting to see what that actually looks like. And I'm really happy that they started with COVID, because I thought that made the most sense. As of now, everyone is still getting are recommended pretty globally to get a booster, regardless of your health risk status or what kind of risk you really have at this point for COVID. So we have not only RFK Jr., but the director of National Institutes of Health and the commissioner of the Food and Drug Administration. They all came out together to change those recommendations. So let's take out this first clip and see what they had to say about these changes.
Hi, everybody. I'm Robert F. Kennedy Jr., your HHS Secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We're now one step closer to realizing President Trump's promise to make America healthy again.
Dr. Cima, what's your thoughts on that?
Yeah, from the start, we always knew, and this was articulated over and over again, how the majority of hospitalizations and deaths from a COVID infection were largely in the elderly population with multiple comorbidities. There really wasn't the numbers that I found in the CDC data, where you were talking about if kids did have a serious hospitalization or even a death, they usually were very ill child to begin with, so they were already weakened. And infections in general across the board, even in different countries and even countries in Africa, they're only attacking the very old and sick and then the very young and sick. They're never taking out regular run-of-the-mill health kind of individuals. So it never made sense to me to vaccinate the children. It never made sense for a lot of things to do with children during that time. But yeah, it was just, you didn't have a statistical data to support it, but you did have a financial incentive. And it was free. So people just thought, well, this is modern medicine. Let's give it a go.
Well, I always wonder too, and this is gonna, of course, maybe this goes into my tinfoil hat, but the government put up a ton of money to basically pre-purchase these vaccines. And people weren't doing them, and so at what point is the government just trying to get its return on investment by making these recommendations to begin with? Because they're like these doctors said on this clip, there was no there's no science. There is absolutely zero science to show that there is any kind of benefit to a healthy child or really even a healthy adult to getting this vaccine, let alone repetitive vaccines. And it really ignores the point. I mean, do you know anybody at this point who hasn't gotten COVID at one point or another? I mean, really, there's probably a very small portion of I won't say it's zero, but I think there's a very small portion of the population that hasn't been infected at some point. And so you're also continuing to ignore the reality of natural immunity. And that's one of my, has been my biggest pet peeve throughout the COVID era and the epidemic in general, is that we totally ignored the hard science that we had of the effectiveness of natural immunity that was at least as effective, probably more effective than the vaccine itself.
That's always the case, and you've even heard Fauci say these things. You've heard other people who said the opposite, but always reiterate this over time and time again over decades. So yeah, it really didn't make sense. It was the only argument that, and we'll go into this later, is just how for some reason there was a lie that you couldn't transmit if you were vaccinated. So, and that's why it even bled into the kids, because they thought that they would, a healthy child would transmit it to an elderly person and potentially hurt them, even though they were supposedly vaccinated. So it just seemed like a money grab overall. And I think like a lot of us, we were kind of losing our mind, for those of us who kind of understand natural immunity and also understand a little bit of epidemiology, to see where they were cooking the books, especially early on. But yeah, it just, and the government never looks for ROI. Let's just call a spade a spade. The government pays off their honors. Unfortunately, that's just what we're seeing day in and day out, current day.
Yeah, and it really, when we talk about when all this was happening and there was these recommendations, it went past an individual decision in many ways. People lost their jobs, and we'll talk more about this when we get into the mandates of vaccine. But people lost their jobs. People lost friends. There's a lot of people who it was kind of like a group of the vaccinated versus the unvaccinated. In fact, we had political leaders saying as much of that, is that the only reason the pandemic was continuing to go on was because of these people who refused to get vaccinated. At the same time, the vaccine didn't prevent you from getting infected. So I'm not sure how that adds up together. And it went back into, you were a terrible person or a terrible, I know you mentioned, before we started the show, about how it even impacted your business, right? About how like patients would want to know, is the staff vaccinated? Are you vaccinated? And I know even from people who, from a business ownership perspective, they were maybe afraid to be sick for 2 weeks and not be able to run their business. And so they got vaccinated based off the information that, hey, this was really effective. This is 99% going to keep you from getting infection, which was a lie the entire time. And that's I think what's really frustrating, is people maybe felt comfortable getting the vaccine, but with the information they had made a choice of between two bad decisions, and made these choices based off this information, and it turned out to be a complete lie. And that's what, to me, is really tough pill to swallow, especially when you have these quote unquote experts continuing to say, regurgitate the same thing. I mean, there's some of these pro-vaccine doctors that are just really upset that these vaccines aren't going to be recommended to person. And I think it's important to realize just because they're not recommended doesn't mean you can't still make the choice to go get the vaccine if you really want to do that.
And that's where it always should be. Any vaccine that comes with a mandate is under duress. So you really can't even ethically apply care at that point. I mean, we're not allowed to provide any care without informed consent to our patients. But if they were mandated to, it would become a moot point. They weren't just using tribalism and social stuff. The president at the time said, our patience is growing thin with you. So there were threats from the highest office in the land. What does that mean, President? That's President. Are you going to like chain me down and stick me in something that you haven't even tested? So there was way more tribalism and attack on, personal small businesses and even the personal rights and liberties. So it was
not mentioned, like you had like some states, luckily we did not have this in Florida, but some states even required children to have these vaccines to return to school. So you had these parents in situations where like, look, hey, both parents are working, or I'm a single parent that's working. My kid needs to go to school. And now I'm forced with this decision to either, vaccinate my child, even though I do not think that's in the best interest of his health, or I can't bring him to school anymore. And that's not the way this should work, by any means. And especially when, to me, it goes against the whole concept of a vaccine. And actually, I believe they did change during the COVID era, actually changed the definition of what a vaccine was. I forget the nuance of that. Maybe you remember, but they changed it because, I mean, really, what is a vaccine supposed to do? It's supposed to stop you from being infected. And this went from hey, this is preventing you from being infected. They moved the goalpost to, okay, now this is just really a treatment to reduce the severity of the disease. And so now we're like, this isn't even a vaccine anymore, in my opinion.
Yeah, I mean, I never saw the vaccine as you're 100% bulletproof from getting an infection from any one bug. A lot of times when you do have infection, you have multiple different pathogens colonizing, and we just don't test for more than 3 or 4 if we do. So it's, in my mind, it was always to lessen the severity of it, and we'll get into that with the measles talk later. But I always thought it was going to reduce the severity of the infection if you were to get it. But yeah, they did just keep moving it to where now you can't even receive it. You won't even enter your system, and somehow your vaccination helped other people, which was never like the common understanding of it. So yeah, it was just a lot of stress, and you wouldn't have to do that if you had good data to back up your argument. Like, I'm not going to argue with you if you show me legit stats that aren't fabricated by just counting everyone who died with COVID or the COVID death. If you gave me good stats, okay, there's some people infected at your age group. This is your chance of dying. It is, 75%. Give me the shot, but it was never that number for really most people.
Yeah, they did this repetitively during COVID. It wasn't just vaccines. They did it with masks. I remember the CDC released a study out of Arizona looking at kids going back to school, and they were trying to make the argument that schools that had mask mandates had less infection than schools that didn't. But they conflated, the data they put out, when you start reading the data, it was like the time periods of the schools that had the vaccine mandates, they weren't even in school. Like, it was during the summer. And so it's like, well, no crap. They didn't get infections related to school because they weren't even in school. I mean, they literally just made the science match what their political narrative was, frankly. And it's amazing to me that and I'm not trying to get left versus right, but at least during that time, it was very much so of trying to fill a political narrative instead of actually, giving us the science. And it's pretty both hilarious and frustrating to hear them now trying to make this, well, you need to trust the scientists and the experts, when it was never about that. It was never about that.
Yeah, and it's like, it's science, it's trust the science, science is settled. That goes against the very spirit of science. Science is never settled. We were the center of the universe at one point. Arsenic was used as medicine at one point. God forbid, we can go into the history of our profession and all the all that we've done. The science is always up for question.
Do we want to talk about, do you even look at that study, James? I kind of forgot.
Which one?
It hasn't been published yet, but the Cleveland Clinic one.
I did a little bit of diving into it with chat just to see what the devil's advocate would say. And the rough part about it is it's not published. So this is authority in that way. And there's all these little things that I don't know what kind of roadblocks could possibly be in the way because I'm just not in that world.
Yeah.
So the way I would phrase it is, at this point, RFK, you're the head of the HHS. You have data everywhere. Start pulling together whatever data you can for longitudinal studies to make your case. Otherwise, start trying to figure out, better ways of managing experiment care.
Yeah, I thought it was amazing, and I feel like Cleveland Clinic has released a couple of these studies throughout the COVID process, but this one in particular, now it hasn't been published yet. I assume they're having the intention of publishing it. I don't know what the rate of Cleveland Clinic being rejected by journals to be published. I would like to think it's actually probably pretty low. But this study showed actually a negative efficacy rate of getting COVID vaccines at this point. So it was negative 23%. So what does that mean? It means it's 23% likely to harm you than to give you benefit. To me, if that ends up being published, that's about as, if you want to talk about settled science on whether you should be getting yearly boosters, I think that probably settles it, wouldn't you say?
Well, of these products, correct, right? Like, so that's what we're testing is these shoddily made products that were made and paid for by government tax dollars with no scrutiny whatsoever. Yeah, so I was referencing a different study that we were talking about earlier. Yeah, that study's pretty damning. So once that study comes out, it's going to be a tough one, especially if you have a higher risk of contracting some sort of sequelae from it. It's not going to be that promising for that side.
And that's what drives me nuts about this is the lack of the ability to say, hey, I was wrong about this. I mean, I've done that before. I've changed my mind and said, hey, more information has come to light, and I'd have a different opinion than I used to, based off how things have changed. I mean, there's plenty of things where that has happened in my world, and the lack of the ability for anyone to say, "Hey, we made the wrong move." I mean, even when they talk about how long they closed schools and that kind of thing, they don't admit it. They don't admit that it was wrong. They'll say, "Oh, we really wanted to open schools. We wanted to do that," but they'll make some sort of spin or reasoning to why they didn't push for that more aggressively. And it's just amazing to me. We're going to talk more about that, about how the lack of the experts to have any sense of hubris is going to further, they're not learning the lessons. They're going to further erode the trust in medicine. And I think that's a bad thing. I mean, it's actually great probably for me and your practices that tend to be a little more alternative anyway, because, people are now seeking out those alternatives. But I don't think it's good either, because I think there's actually, I mean, I still think people, when they have a heart attack, they need to go to the hospital. I mean, every now and then you might need an open heart surgery, right? So I don't want people to be distrusting that because of this, and they need to wake up to that.
Yeah, that was evident. I watched Gavin Newsom on the Sean Ryan show, and Joe Rogan texted Sean to ask Gavin, because he was going to be on there.
Right.
Do you feel bad at all? Are you take any responsibility for all the stuff you did during this time? And he just scapegoated everybody else in the bureaucracy and the advisory boards, and that is always the biggest problem. And I think it's even a big problem along medical care anyway. The doctor doesn't really want to be questioned. And I think that definitely breeds in academia and in those higher bureaucratic systems. Your leaders, you don't want to show weakness. If you do that, that erodes the trust. But in a paradoxical way, it actually builds trust when you are able to say, yes, that was a mistake. Looking back, hindsight's 2020. I apologize for that. That would go a very long way at this age, but there's too many dollars at stake. You're talking about losing trust in some of the largest publicly traded companies on the planet. And a lot of these.
So let's move on to the next thing that happened that's happened recently and got obviously a lot of news was Dr. Susan Monterez, which was the head of the CDC. She was fired, and what she's saying is that she refused to go along with the new vaccine recommendations and basically rubber stamp all of the new members of the advisory board. And so that's what she's saying. Secretary Kennedy has pushed back against that a bit. But as a result of her being fired, 4 of the quote unquote leading scientists at the CDC resigned. One of them, Dr. Descalis, interesting guy, was very concerned about what Secretary Kennedy was doing. Supposedly, according to Secretary Kennedy, was also withholding vaccine safety information, which if these things are so safe, I don't understand why we're withholding information. But let's hear what he had to say.
I mean, from my vantage point as a doctor who's taken the Hippocratic Oath, I only see harm coming. I may be wrong, but based on what I'm seeing, based on what I've heard with the new members of the Advisory Committee for Immunization Practices, or ACIP, they're really moving in an ideologic direction where they want to see the undoing of vaccination. They do want to see the undoing of mRNA vaccination. They have a very specific target on COVID, but I do fear that they have other things that they are going to be working on. Hepatitis B vaccine is on the agenda for the meeting in September. I predict that what they're going to do is try to change the birth dose of hepatitis B vaccine so that kids don't get it when they're born. So if you have a mother who is well connected to care, her hepatitis B status, that may not matter very much. But if you have a mother who's not gone to prenatal care, who comes in to deliver, we have one bite at that apple so that child gets that important hepatitis B vaccine.
I mean, this whole argument is insane to me. I remember always wondering, why the heck did we vaccinate newborn infants for hepatitis B? And I remember asking that exact question when our son, when my wife was in labor. I was like, why do you guys even do this? Like, it's a sexually transmitted disease, or it can be transmitted if you share needles with an infected person. These aren't risk factors that I'm thinking a newborn infant are going to have typically. And so when I asked that question, it was basically, the reasoning is exactly what was said in that clip, is that if a mother has hepatitis B infection and gives birth, it could potentially help the infant if you give the vaccine right away, right after birth. But I mean, what percentage of mothers who are giving birth have hepatitis B, number one, and number two, how hard is it to figure that out instead of doing this global vaccination protocol for a vast majority of the children who aren't going to need it?
Yeah, so it's really small. Because he actually worked on a subsection even smaller, just saying ones with no prenatal care. So that's 2% of the 3.6 million births a year. And I'm rounding numbers up. Of that 2%, you're looking at maybe a possibility, and this is with CDC data that I'll make available for the episode, 200 to 400 births a year max that you would have to, you could use it and it would make sense. So do I do 200 or 400 jabs, or do I do 3.6 million? So it's like you see the financial incentive. You don't necessarily see the statistical reasoning to give that at that time, when you could easily give it when they're 12, 15. Most people with Hep B are 30 plus anyway. There's really no rush if you're trying to inoculate against IV transmission. But yeah, it doesn't make any sense statistically. But yeah, it's tough when you start breaking the numbers. I mean, he gave you the exact argument, and then he also shot himself in the foot. So they're kind of being honest, but they're hoping you don't look through the numbers.
That's right. Yeah, no, exactly. And to me, to make that your battle cry of how we're undoing, I use his words, undoing vaccination. I don't see that as undoing vaccination. That's just common sense and making vaccination customized to a patient's risk, which is what we should be doing. I think that is the biggest problem in medicine. I understand that having general guidelines makes it much easier to implement across a large population, but we have to be able to discuss that nuance, and we have to be giving providers the flexibility and the support to customize to their patients. I mean, it's silly. There's very little things in medicine that I think can be done across the board like that.
And they're usually only in the severe cases where someone is coming in cardiac failure. It's like those are the times where it's like, no, screw the, uniqueness of it, fix the problems that you're getting objectively. Yeah, but when you're talking about childbirth, you have, the status of the month. Like my wife got a Hep B screening before when she was pregnant with our first son. There was going to be no shot of transmission. Why would we inject Hep B right then?
Yeah, there's no reason for it. And the other one he mentioned, well, I guess he was talking about mRNA, so he didn't mention this one, but the other vaccine that's, going to get a lot of attention is MMR. And I know, just recently, I think there was a decision, or they're leaning towards a decision of separating out the MMR vaccine. So it's no longer recommended to be given as a combination vaccine, but individual vaccines for each disease, which not necessarily what I wanted to talk about. But, one thing that everyone seems to be saying is like, oh, there's going to be these great measles outbreaks. And there's been some measles outbreaks. It's kind of interesting because our outbreaks have been worse than countries that have lower measles vaccination rates, especially in Europe. There's some European countries that have had higher outbreaks of measles, even though they have higher vaccination rates. So it's not really kind of making sense on that aspect of things. But you also brought up a good point. If we could bring up one of those charts that you had mentioned to me on how the changes in measles rates and mortality were already happening before the vaccination.
Yeah. So top chart, you're looking at cases, registered or diagnosed, and then bottom chart is deaths. And if you were to guess when the measles vaccine came in, you would think, oh, probably like right at 1940. But really, the vaccine wasn't made available for measles until 1963. So the deaths from measles plummeted well before, and it really didn't make too much of a difference on the trend and where it was going. What did make a massive difference was public health services like water treatment, electricity, refrigeration, nutrition. We were actually having a sewage system. So we had big advancements in society that really protected us and keeping our inflammatory burden a lot lower. So when we did get an infection, it wasn't as severe. Going back to if vaccines prevent infection or lessen the severity of an illness, that's where this kind of comes in. So if we do get vaccinated now with measles and the baby gets sick or the child gets sick, they're getting most of the symptoms that a normal measles case would do, just not that rash. That was really diagnostic for the majority of the 1900s. Would it be possible that the vaccine is just dampening the symptoms so maybe doesn't go to the progressive rash? Is that the possibility? So you're still getting measles infection. You're just not tested for it, because why would you if they're vaccinated? So, yeah, when you look at the data, you think, but there's been studies done. I go back to McKinley in 1977, which is 50 years old. But their quote was, analysis attributes only a small portion, often less than 5% of mortality decline from major infectious disease to medical interventions. Most improvements came from sanitation, nutrition, and socioeconomic changes. And then there was another study by the CDC in 2000 that said about 90% of the drop in infectious disease mortality among U.S. children had already occurred before 1940, before most vaccines and antibiotics were widely available. So this is their own information. This isn't, I'm not making this up. This is the CDC in year 2000 that said this quote.
Yeah, and my other thing about that is, like, especially measles, they talk about, oh, but there's no treatment. I'm like, but the vitamin A has been a gold standard treatment for years and years and years. So it's another just disingenuous talking point that they continue to roll out.